various lands on which we are all working today, and the Aboriginal and Torres Strait Islander people participating. I pay my respects to the elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of Australia. So a big welcome to the webinar today on the transmission of SARS-CoV-2 in New South Wales educational settings. Firstly, some housekeeping. There will be a video of the webinar emailed to all attendees and available by our website in the coming days. Our Q&A panel will be answering select questions at the end of the webinar. So please submit your questions throughout the webinar via the Q&A tab in the Zoom controls. If you see a question that you would also like to have answered, you can upvote that question by clicking the thumbs up beside it. So we have an amazing array of speakers this afternoon. Dr. Kerry Chand has kindly agreed to provide some opening remarks, and our speakers for today are Dr. Archana Kerala and Marnie O'Brien. As many of you will know, I'm sure all of you will know, Dr. Kerry Chand is the Chief Health Officer and Deputy Secretary, Population and Public Health at the New South Wales Ministry of Health. The New South Wales Ministry of Health have collaborated closely with NCIRS and the New South Wales Department of Education. Dr. Archana Kerala is a paediatric infectious diseases specialist, general paediatrician and staff specialist here at NCIRS. She has been leading the COVID in educational settings project and working here at the team in NCIRS. And Marnie O'Brien is the Executive Director, Health and Safety at the Department of Education. Marnie has also been working very closely with New South Wales Health and other key agencies to develop and lead the risk management program across the Department of Education to enable schools to continue to deliver educational services in a COVID-safe way. So welcome everyone, and I'd now like to hand over to Kerry to say a few words. Many thanks, Kerry.
Thanks very much, and thank you all for joining us. I wanted to let you know that we're in the final stages of providing our revised advice for Term 4, and we've very much based that on the interactions that we've had with the study feedback, and also drawing upon the expertise of NCIRS on the international experience with COVID transmission. In New South Wales, we did experience some seeding from Victoria, which did establish multiple chains of transmission. We are coming hopefully to the end of those chains of transmission, but it is too premature to exclude that we do still have lingering community transmission, particularly in Western Sydney and Southwestern Sydney. And so ongoing vigilance is required. But our case numbers in recent days have been somewhat reassuring in the sense that the cases have all been linked to known cases, and the majority have been recognised in people already in isolation. Obviously, we continue to identify cases in returning overseas travellers, and more recently those cases have increased, reflecting the increased burden of COVID-19 internationally in returning travellers. Thanks, Nick. That's all I wanted to say, but just to flag that we are going to be updating our advice for schools. So we can talk in broad terms, but that's in the final stages, and it will be distributed this week.
Great, thanks very much, Kerry, and for giving us up your time today, and we know how busy you are. So I'll now hand over to Archana, who will talk us through the approach we've taken and what the latest data shows. Thanks, Arch.
Thanks, Nick. So I'm a paediatrician at the National Centre for Immunisation Research and Surveillance. And so my talk really will be the evidence around the transmission of SARS-CoV-2 in educational settings. So I'll start broadly and then I'll discuss New South Wales. So I just wanted to acknowledge that the vast team that's been involved in the study that we've conducted here, but more importantly to thank all the school staffs and student contacts and their families who participated in this work, especially those who assisted us with the enhanced investigations. So just a quick summary slide. COVID-19 is caused by a coronavirus SARS-CoV-2. It emerged in November December of 2019, was noted initially in Wuhan, China, but as everyone knows, it's since become a global pandemic with 31 million cases and up to 1 million deaths worldwide. And COVID-19 has had a huge impact on education. As SARS-CoV-2 was spread across the globe and cases were identified, the majority of countries by the 3rd of March either closed schools or schools only remained partially open. And you can see from this figure that's on the UNESCO website that 1.5 billion learners, or 87.6% of the school-age population, were affected in March. I've included the link and you're able to move the cursor through time to see what has happened since. So the closure of schools, why do we close? Why were schools closed? Well, there were potentially some possible benefits, and really the aim was to reduce viral transmission. It also reduces the travel and movement of people. We know that children have mild symptoms, and so there was a huge question of whether they would bring it home to the family and infect the others within the family, in particular the elders. There was also discussion about limiting introduction of this virus to a setting where children were unable to adequately be physically distanced, and also to protect our teachers. But there are quite a lot of adverse consequences to the closure of schools. It causes interrupted learning, confusion and stress for teachers. Parents are unable to work and provide for their family. It increases education disparity. There are a rise in dropout rates and a decrease to return to school. There is social isolation and increased exposure to vulnerabilities at home. So the question remains, does closing school reduce viral transmission? Or is the question, does keeping schools open or reopening schools increase viral transmission? And there have been a number of reports and studies that have reported globally, which I will go through. So the initial report started out in the Republic of Ireland. The first Irish case of COVID-19 in a school-age child was diagnosed in March 2020. And this was before any mitigation strategy had been put in place. They found that there were 3 pediatric cases and 3 adult cases who attended the school. And when they looked at the contacts, there were over 1,000 contacts, and all symptomatic cases were tested, but there were no secondary cases. I move on to Israel. Now, Israel, they closed their school on the 13th of March due to increasing number of COVID-19 cases, but they fully reopened on the 17th of May due to decreased case burden within the country. 1 week after opening, they noticed that there were noticed 2 index cases, both in high schools. And this was a high school with over 1,000 students and over 100 staff. Opening of schools included hygiene measures such as regular washing of hands, use of face masks, social distancing, and class bubbles. And so when they tested the entire school, they found 153 students and 25 staff members were also positive for COVID-19. The cause of this transmission, they felt, was because of overcrowding of classes. There were up to 38 high school students within a class. It was a time of an extreme heat wave, and there was continuous air conditioning with very little ventilation. And you must have heard in the media a lot about the recent cases in the United States of America. There aren't any specific studies looking at schools in the USA. However, public health, however, it's been noted that since the start of the school year, there has been an increase in child cases reported. So between the 27th of August and the 9th of September, that there were 72,993 new child cases reported, and this was noted to be a 15% increase. Now I'm moving on to some countries that have done, that have actually studied the transmission within the school setting. So I bring ourselves to the United Kingdom. The UK also closed schools early on in their epidemic, so on the 20th of March, with wider lockdown measures announced on the 23rd of March 2020. However, children of key workers could attend school throughout the epidemic, and gradual easing of lockdown measures in England began on the 10th of May and from the 1st of June. So school resumed on the 1st of June for a summer mini term for approximately 6 weeks. On-school mitigation strategies included the use of smaller class sizes, social bubbles, so you remained in a cohort of students that throughout the day, and implementation of frequent hand washing and hand hygiene. So the number of students who attended school during this period increased from approximately 400,000 to 1.6 million students. This was primarily in the childcare or primary school setting. Very few high schoolers re-attended school face-to-face. So what did they found? Well, they found that there were approximately 101 index cases. Of those, 70 were students and 28 staff members. 4 were co-primary, so they were students within the same household. And in terms of secondary cases, they found that in 67 schools and nursery settings that there were no secondary cases. In 30 settings with secondary cases, half of those only had 1 secondary case. And interestingly, if the index case was a child, the maximum number of secondary cases was 2, compared to 9 if the index case was a staff member. So they found that there was a strong correlation between the likelihood of an outbreak in an educational setting and the regional COVID-19 incidence. So the number of cases within the community. But they found that the risk of outbreaks were low. In England, they also, in parallel, conducted a study called COVID-19 Surveillance in School Kids. You can see this map of the lower United Kingdom, and the green dots indicate the schools that participated in the weekly swab program. The dots in red include the schools that participated in the serology or the blood test program. So what did they do? Within the summer half term, they, in participating schools, they did weekly swabs of students and staff between the 4 to 6 week period. In other schools, within the first 2 weeks, they consented for children and staff members to do a blood test. And what the blood test looked for was evidence of antibodies, which is an immune response to the the virus that causes COVID-19. And it's a way of us understanding whether that individual had been exposed. So they had approximately 12,000 participants within 131 schools, and 43,000 swabs were taken. Of those, they only identified 3 additional cases, 1 student and 2 teachers. There were no additional cases within those, within households, within the class bubbles, or the wider educational setting. So these 3 cases didn't actually transmit to anyone else. In the schools that conducted the blood test, they found that approximately 10% of students and 13% of staff had been exposed to COVID-19. And this was similar to the rates within the community. So this gives us an idea that students may be at similar risk to adults in terms of getting the disease or being exposed to the disease, but it shows that potentially that they're much less likely to transmit, especially within the school setting. So I come a bit closer to home to our South Korean colleagues. Once again, they had closed schools early in their epidemic, And then schools restarted face-to-face on the 20th of May. And they analyzed data between the 20th of May and the beginning of July, sorry. Now, in South Korea, mitigation strategies were quite different to those in New South Wales. They were quite strict with the 1.5 metre distancing rule, even whilst going into a class and waiting for lunch at the, in their school hall. They also used perspex glass to separate students, both within the classroom and in the lunchroom setting. And all students were advised to wear masks. What they found was that there were no sudden increase in pediatric cases after the school reopened. So the proportion of cases remained similar to before school opening and after school opening at approximately 7%. They did find that 45 children were positive for COVID from 40 schools and preschools, and as a consequence, more than 11,000 students and staff were tested. But what they found, again, similar to the UK, was that really there was only one school where secondary cases were identified. This was a primary school, and the index case transmitted to 2 other students. Interestingly, in some of the index cases within the high school, there were a number of students that attended an academy for acting and singing, and they developed COVID-19 as secondary to the exposure within this academy, but they didn't transmit it to the school once they were infectious. So really, it's important to strike a balance. And for that, we would need to understand how many cases have attended the school whilst infectious. What have schools put in place to prevent the transmission of COVID-19? How do schools respond to an infectious case? And what the rate of secondary transmission is in our local setting. So it's really a balance between school-based mitigation strategies, our public health response, and our local incidence of disease. So within New South Wales, we also had an initial wave that started in early February. By the 23rd of March, it was recommended that students, there was decreased attendance of students within school settings, apart from students who were vulnerable or students of children of essential workers. School resumed to full attendance on the 23rd of May with certain mitigation strategies such as limiting parents on site, additional cleaning, hand hygiene, limiting interactions between different stages within a school. And more recently, there have been further mitigation strategies in sports and limiting music and singing. So what have we found in New South Wales? Well, in term 1, there were 27 cases within 25 settings. Of those, 12 were students and 15 were staff members. In term 2, you can see that the disease burden was very low within New South Wales. And so as a consequence, we also saw low levels of index cases within educational settings. And in term 3, there's been increased low levels of community transmission. And as a consequence, we've also seen an increased number of index cases in school and childcare settings. So 33 students and 7 staff members. So this graph just highlights the initial epidemic curve in New South Wales, and you can see that there were multitude of mitigation strategies that were implemented widely within New South Wales that as part of our wider public health response. And you can also see that even the data from New South Wales, the majority of index cases that attended educational settings were during times when attendance within schools was still high. So what did New South Wales do? Well, when there was a case, it triggered a public health response, which was a response, a collaboration between the Ministry of Health, Ministry of Education, and the Public Health Unit. A contacts list was developed. We were also involved. And schools could follow a routine follow-up or monitor with public health. And so anyone who was symptomatic were asked to be tested. We also conducted enhanced investigation through a survey, additional nose and throat swabbing, so even asymptomatic contacts were offered a swab, and also a blood test for antibodies approximately a month after exposure. And as a consequence, we were able to determine secondary cases. In term 3, routine follow-up included a nose and throat swab sample when an index case was diagnosed within an educational setting and also prior to re-attendance at school. And so what we found that New South Wales Health had followed up approximately 4,000 high school students. Of those, only 29 cases were positive. In primary schools, over 1,000 contacts and only 5 were positive. And in childcare and preschool settings, once again, over 1,000 contacts with only 15 positives. And, in term 1, there was 1 childcare setting out of 10 that had secondary cases. And in term 3, there have been only 3 high schools with with more than 1 or 2 secondary cases. And so what have we found out? Well, in term 1, contributing factors to transmission were a delayed primary case diagnosis, potential combining of classrooms, and a close mixing of staff and children, as well as shared physical amenities. And in term 3, we learned that potentially causes of spread were sentinel seating events like overnight stays, as well as potential with singing or music groups. Also attendance while symptomatic. And, if you had increased contact hours with the index case, you were at higher risk. And so I only have a few more slides. This slide just talks about the activities and their risk. Really, in terms of singing and choir practices, the data comes from adult choirs. So within the US, and they found that, congregations within adult choirs, that there was a likelihood of increased transmission, and also that church congregations were noted to be outbreak sources. And so really the louder you kind of projected your voice was potentially a higher risk. In terms of sports, where there is quite close contact, it's a potential risk. Indoor with a decreased amount of ventilation, again, was a higher risk. And in terms of overnight camp, there have been outbreak reports within US summer camps, but there have also been reports where outbreaks have been prevented due to good COVID-safe practices. This is just a heads up to our Western Australian colleagues. They've also undertaken a study within Western Australia trying to identify any additional school positive cases. They've had none, but importantly, they've used a well-being survey, and they've been able to survey up to 25,000 students, and the data is still pending. So I come to my last slide. Really, the likelihood of seeing a case attend a school is proportionate to the extent of community transmission. Transmission within school settings is low in the context of a strong public health and education response. And schools overall do not seem to be drivers of infection. Transmission can occur, however, and it is more likely to be amongst staff or high school students. And so school-based activities really need to be aligned with the community incidence of disease. Early identification of a case equals a lower risk of transmission, and a coordinated health and education response is vital. The closure of schools and uncertainty of pandemic takes a toll on our students and our teachers as well, in terms of stress and a mental health toll. And so we really need to be cognizant of that. So education is the most powerful weapon which you can choose to change the world. And these are just some faces of the students that have attended schools and preschools this year. And we're here alongside our colleagues to make their education as seamless and as educational as possible. Thank you. I'll now hand over to Marnie to give us a perspective from education.
Thanks very much. I'll just share my slide presentation. I won't be a second while I'm bringing this up. Good afternoon, everybody. It's been a really interesting look at the data from the research that has, been taking place inside our educational settings. So I'd just like to thank the NCIRS team for being able to work so closely with us and with our schools to be able to get this really vital data. Today, I just wanted to talk through the work that we've been doing inside education. I just thought it'd be useful to take you all on a bit of a journey, because it's been a very interesting 2020 for us all. And I think really just to get some context and some perspective about how big and how broad the reach has been, and therefore how important the work has been that we've been doing together, would be really useful just to sort of provide some context to the situation. So the Department of Education, we've got over 2,200 public schools across New South Wales. They come in all different types of settings. So your primary, your secondary, and we've got our specialist settings as well in our central schools. We have very large schools and very small schools. In addition to the public schools, we also have up to around 1,000 non-government schools as well. And so when you think about the large number of staff and students that we have at our reach and at our disposal that we care for and deliver services to every day, there's over 800,000 students across New South Wales just in the public setting alone. So very much a part of what we have been focused on is not just how schools function and operate and how we keep our staff and our students safe, but also the amazing reach that we have as being active members of the community and being able to support the broader state response to the COVID pandemic as well. If you think about the number of staff and students that we have inside our school settings, and you think about the parents and the extended family members, we've got a really good reach across the community, which has been also an element of the approach that we've taken to try and share information, educate people about where the risks are and what we need to do, and how we need to work together as a broader community to try and address the issues of this pandemic across the broad community. The primary approach that we've taken inside education has been sort of a three-tiered approach. Obviously, we've looked at it from a prevention perspective. If we can keep the virus out of our school environments, then of course that's the aim of the game. Secondly to that, if we're successful in keeping it out of our school environments through effective risk management practices and prevention methods, well, of course, that also reduces the risk of transmission to the broader local community of those schools as well. So that's a benefit to the broader community inside New South Wales. We've also been heavily focused on a COVID case response protocols, and it's been really important for us to work very closely with our colleagues in the Public Health Unit and the Ministry of Health to be able to design some processes which allow us to work collaboratively together and as rapidly as possible to be able to identify close contacts and really work thoroughly to put the measures and the processes in place to minimise the risk of further transmission inside the school setting. And there's been an enormous effort, and we've got lots that we've learned throughout this journey together, which I'll talk through more in a minute. The third element of the approach that we've adopted has been very much one around research and understanding. So we have been looking to what others have been doing internationally. We've obviously engaged with NCIRS around looking at studying what the experience here in New South Wales has been in relation to student transmission rates whilst at school, because it's really important that we get as much information as we can, because that then informs some of the policy decisions that we are undertaking, again, jointly with New South Wales Health under their expert advice, and also at the national level, how we can contribute to some of the decision making that needs to take place around how we can continue to curb and control the virus across Australia as well as across the state. The journey that we went on, and I don't want to bore anybody with this, but I think, again, it's really important to have some context about the experience that New South Wales schools have had. The research tells us around, you know, the transmission rates and what we've learnt from the virus itself inside those educational settings. What I think is a really important complement to that piece of work is the experience that our schools have had in being able to learn and then introduce the necessary strategies and changes to the way in which schools function and operate in order for us to be able to respond to what we are learning all the time about this virus and how it functions and operates amongst the broader community. So back in January, when I first got the lovely phone call from Health to say, look, there was an emerging problem internationally and that we really needed to start to dust off any pandemic planning arrangements and start to think about engaging in some discussions with the relevant stakeholders to work through some planning. We really focused initially on understanding how we could minimise the risk of that infection entering into New South Wales. So we started inside schools. Again, schools have been very much in the front line of the statewide response to this, even right back in January. I remember being Australia Day, writing up some protocols to exclude those staff and students that were returning from overseas, from the Wuhan province. And then as, you know, January and February unfolded, there was a growing list of regions across the world where we were excluding staff and students from returning from those countries back into our schools until they'd served a quarantine period to try and minimise the risk of transmission. Now that sounds all very basic and simple, but from a school operational perspective, it was actually a really major effort and a huge distraction to commence the school year for schools in trying to track down and identify and work with families in a very new environment, and we knew very little about this disease, to try and make sure that they could do their part and minimise the risk inside their local school environment. So it was a great deal of effort and a great deal of you know, good work done by our schools to try and really curb and control the early stages of the pandemic. During that same time, we started out as conversations through the State Emergency Operations Centre and New South Wales Health at a national level, at a jurisdictional level, to start to think through what sort of issues and protocols and strategies we might need to put in place to respond to an emerging, you know, global pandemic as it was starting to very much unfold. So that included getting prepared and organised for things like our confirmed case contracting processes, so that if we had a confirmed case whilst at school, how would we respond and manage the risks associated with that? How would we communicate with the broader community? And what would be the actions that we would need to guide and support schools through to manage and mitigate against those risks? We were also looking at enhanced cleaning arrangements, so we were seeking national as well as state health advice to understand what the cleaning protocols were, which of course resulted in our enhanced cleaning arrangements. So that meant that we were increasing the number of hours of cleaning inside our schools. And we also later in that process introduced daytime cleaning of high touch surfaces and the wipe down of school bathrooms after the recess and lunch period, again, to try and minimise and curb the risk of transmission whilst inside schools. So there was a lot of work and a lot of effort put into introducing those inside our schools. I'm sure you will all remember early on in the piece that we had some panic in New South Wales. In fact, we had some panic nationally around access to hygiene products and supplies. So we were all running around trying to get hold of those rolls of toilet paper and those cakes of soap, etc. That created some real disruption inside our school system. So we very quickly and rapidly shifted from an educational service provider to a supply and distribution warehouse, where we set up and tried to internationally as well as nationally get our hands on as many supplies as we possibly could and allocate those out statewide to schools to keep them operational while there was a shortage in the market. Thankfully, we're able to get a lot of schools the supplies that they needed to be able to continue to operate in that first early instance. And then as supply started to flow through, of course, schools were able to transition back. But that promotion of good personal hygiene was obviously a major focus for us around the cleaning as well as the hygiene supplies and the introduction of hand sanitizers, etc. as well. We also started to have a look at some of our high risk activities in our high risk settings. So there was a lot of work being done around what sort of PPE would be required in our schools for special purposes, where they're doing, you know, more invasive type procedures for students such as suctioning and tube feeding, etc. Making sure we're getting expert advice from health in relation to what sort of activities would require physical distancing in that early stage. Because if you remember back in this early stage, we weren't quite sure exactly how this virus was being transmitted. And so we're really adopting a stock standard approach in the early stage around physical distancing and personal hygiene strategies. Once we got to March, we then looked at the next stage of our process, because as if you remember back to the slide that Archana put up, we started to see an increase in the number of cases within the broader community. We too had our first case in early March where it had impacted a school. We did have confirmed case protocols in place, and so New South Wales Health and the department were able to very rapidly respond to that situation and road test the decisions that we'd made and the resources that we had developed. And thankfully they proved very successful at the time. We have since evolved those as more and more cases have come through. But in March, April, we certainly started to escalate our activity. We started to shift to remote learning, and schools remained operational for students of critical service workers and vulnerable students. Our schools did an amazing job at transitioning to remote learning with very short notice. We were able as a sector to be able to get up a remote learning hub to try and support schools in that process. And so there was an enormous amount of effort and energy going into making sure that we could continue delivering educational services as best we could under very difficult circumstances. And once again, our schools were amazing in their response and their ability to be agile enough to be able to transition to that stage. Whilst we were in, schools had less students attending face-to-face, and that we were delivering and working, remotely, we invested that time in starting to look at strategies to start to scale schools back up to full on-campus learning. So that was really a time when we started to really introduce the new approach that you see in place inside schools now, which is what restrictions on certain activities would we need to put into play, what sort of physical distancing strategies would we need to put into place, and what sort of strength and infection control processes around the activities that schools are delivering would we need to introduce. And so we introduced our Term 2 guidelines for schools, which we also shared with parents to say, here's how schools are going to function and operate. And there was a range of restrictions that we had as we started to progressively work schools back towards, full-time on-campus learning. So schools really went to not being able to have parents participate and attend schools, looking at drop-off and pick-up times to minimise the number of adults on our school sites. We've, no school excursions, no overnight, school excursions and events. We restricted sporting activities and more of those contact related activities that were happening inside schools. Now that was quite challenging and very demanding for schools in those early stages. And as we worked through Term 2, we were able to reduce a number of those restrictions and start to give schools a better sense of pre-COVID normal with only some minor restrictions in place. Unfortunately, we did have an increase in numbers, as we all know, after the Term 2 school holidays, and we did see an increase in the number of schools where we were experiencing confirmed cases of COVID. So we have reintroduced some restrictions towards the end of term 3, and they are primarily around choirs, chanting and singing, inter-school sporting activities, and, you know, obviously one of the big challenges for us was starting to really think about and work on the HSC issues and school graduation ceremonies. So they have been, there's been a lot of focus around what we need to do to plan for and prepare for those things so that they can be delivered in a COVID safe way. Very much again at the base of all of that, of course, is our personal hygiene, infection control measures and strategies, as well as our physical distancing responsibilities. And so all of these activities that are happening in schools, I've got a team that work with me that are constantly looking at what it is that we need to do and adjust to provide advice to schools to be able to allow them to continue to deliver as many activities as possible, but in a COVID safe way. To give you some idea of where we're at now, obviously we're at the end of term 3 and we're heading into term 4. As Kerry said at the beginning of this webinar, we are very much at the final stages of understanding exactly what we are looking to introduce inside the term 4 guidelines for schools. So some of the things that we are working our way through at the moment to ensure we've got some COVID safe activities is, you know, making sure that our school vacation care arrangements and all of those activities that kids are doing during the school holiday period can continue to function as much as normal, but with some COVID safe requirements built in around them. So there's been a lot of work done on that. We are currently looking at, and we have rescheduled our opportunity class testing, and they've been rescheduled for November. So we are very much looking at a new way of delivering those tests where the vast majority of those will be sat inside our primary schools with a small number of testing centres set up across the state with some COVID safe arrangements in place. Our kindergarten and year 7 orientation programs, we've had to place them on hold this term, but we have strategies and some COVID safe arrangements that we're going to be introducing in term 4, where we're really hopeful to get those off the ground next term and enable those kids the opportunity to familiarise themselves with their new school environments, which is a really important thing for the kindergarten kids as well as the year 7 students that are entering high school. We're also looking at graduations and end of year celebrations to try and give kids some sense of celebration towards the end of the year, given that they've made it through such a complex year with lots of disruption and lots of new ways of doing things. So we're looking at some arrangements to make sure that we can still get those celebrations, albeit if, you know, they may not be able to have parental attendance, at least the kids can share and celebrate together at the very least. We're also looking at easing up some restrictions around, you know, day excursions and field trips and, you know, other sorts of activities that are currently on hold at the moment. And we're just working our way through the final stages, and we'll have some advice for schools very soon around what that looks like. And going forward, we're starting to plan for term 1, believe it or not, as well. So looking at the issue of international students and the impact on boarding school students in relation to the border closures that we've had. These are really big issues that we are working through and constantly looking at what it is that we need to do and adjust and provide advice out to families and schools to ensure that what we're doing is done in a COVID safe way and minimising the risk of transmission through the broader community. Just very quickly, we've had lots of learnings along the way, and this won't be any surprise to anybody. People's ability to be able to be agile and rapidly pivot what they're doing and develop new ways of delivering services and supporting the needs of staff and students in schools has been outstanding. It is absolutely inspirational to see what schools have been doing. And it just goes to show how amazing our schools are. And that's government and non-government schools. They've really done an amazing and an outstanding job in a very difficult year. We've also identified that it's critical for us to have a consistent approach across all 3 education sectors. We have worked so closely with the non-government school sectors, TAFE New South Wales, and even in many degrees with the early childhood sector to make sure that we're getting a consistent approach to make it simple and easy for schools and for families to understand how schools need to function and operate in a COVID safe way. And a huge shout out to those non-government schools for really working collaboratively with us throughout this whole year. The technical expertise that has come to us at a national and a state level has been outstanding. We could not have made the decisions that we have made, many of them very, very late at night and most of them on weekends. So those relationships and that expert advice has been absolutely essential and vital to us being able to keep schools functioning and operating safely. And having the systems and processes that we've put in place, as challenging and as difficult as that has been for schools, has really allowed us to understand where we're at and then inform that research that we have been doing to understand at which point what we've been doing when and how we've been doing it and whether it's been having an impact, which is of course going to inform how we work together going forward. So I think the infection control, physical distancing, restrictions we've had in place inside schools, I believe has contributed to a better outcome for New South Wales. I think it's the collaboration and the joint effort between, you know, students and the way in which we've adopted technology together has really put us in a good position to be able to manage this, you know, really well. Just a quick last second shout out, because I think I'm over time, but I just wanted to really recognise that the amazing work the schools have done is evident, I think, with the minimal transmission rates that we're seeing in schools. I think these strategies have worked, and it has been a huge joint effort, not just from the Education Department, but from a whole range of different agencies and the non-government sector. So I just wanted to make sure that everybody understood just what a mammoth effort this has been and what a collaborative approach we've adopted. Thank you.
So thanks to those who have submitted questions. We had some submitted prior to the webinar and then a couple during it. We've got Professor Christine McCartney, the NCIRS Director, available for answering questions during the Q&A, and also Dr. Kerry Chant has stayed with us to help out on our Q&A panel. What we'll do is we'll probably start with a question for Kerry. A question for you is how will the learnings from the research be implemented in schools in New South Wales as we approach term 4?
So I think the slide that was presented early on highlights the sort of interconnectivity between where you are with community transmission and also the controls that you can put in place in schools, plus also the learnings. We are now, I'd mentioned before that we had seen an upswing in cases, and we'd actually seen it get into schools and in a younger cohort. And we had a number of cases in schools that were infectious at their time. It's pleasing to see that that hasn't resulted in a lot of ongoing transmission in the schools, but clearly to have that reinforced through this research is really key. Some of the learnings will be adopted in the new guidelines that will be implemented, but those guidelines will be informed by international evidence that was presented here, as well as about the sort of risky activities and how we can minimise those, but also recognising that our level of community transmission is actually quite low at the moment. We're optimistic that we're driving down towards low community transmission, and why I hesitate is because it takes a period of time of high testing rates and community engagement to ever know that you've actually achieved that. And this is a very challenging virus because it can present with mild disease in many, and so you need that quite protracted period of time to be assured that you've got on top of community transmission. But clearly the fact that we're announcing no locally acquired cases for a period of time that we don't track back to a source is pleasing.
Thanks, Kerry. While I've got you, I might just get you to answer another one. So someone has asked, why has it, and probably this is particularly in the past, but I guess it still occurs sometimes, is why is it that sometimes the local regulations out there in the community differ slightly from what's required in school settings?
I think it recognises this is always a balancing act about what's practical in schools, and the recognition that we've had from an early phase is that unlike other infectious viruses, when we started on this journey, we had observed that coronavirus appeared to act differently in children. And I think this work that we've done with NCIRS really reinforces this. So it does mean that the controls we put in place are unique to schools. We've worked really hard to minimise those risks, such as, preventing unnecessary parent engagement into the schools or adults coming into the school environment, because we recognised they were at risk. We've also instituted the hygiene and other controls in schools. And so there have been different settings in other outside, but it recognises the unique controls we can put in school that are fit for that environment. And because it is so important for educational attainment, social cohesion, and has those other dimensions, we've worked very hard to balance managing COVID with balancing those other benefits of keeping children engaged with education.
Well, if I could just add, I think this concept that we've been learning along the way too can't be overstated. I think obviously the experience here in New South Wales across the whole of Australia has been looked upon by other parts of the world. We've looked at other experience from other parts of the world, and I think what's very reassuring to me is that we're seeing similar findings come through from different contexts where study of the virus and the transmission in schools has been able to occur. But everything has to be tailored to having that fine balance between ensuring we can try to live in a COVID safe way, which is the term, but obviously really keep community transmission low, because that's so important. And I think particularly acknowledge the leadership of Kerry, New South Wales Health and New South Wales Education in the success that has been that in that perspective in New South Wales.
Thanks, Christine. Okay, might go to Marnie now. Now you've touched a bit on plans for term 4. Are you able to give any specific information, particularly if you know when people will likely hear about orientation plans? So is there likely to be any advice that comes out before term 4 starts, or is it likely to be a bit after that?
Yeah, so we're working really hard to finalise our position with New South Wales Health at the moment, and I can reassure everybody I've got a crew of people updating fact sheets and resources and things in anticipation of the things that we've sort of locked down and got cleared. The aim is for us to have a clear position by the end of this week. When those resources get released, of course, will just sort of depend on the timing of getting all of those pushed up through the relevant stakeholders, etc. But we will certainly be aiming to get the information and the resources out to schools as quickly as possible. And I would assume that all things going good and equal, it should certainly be early in the first week of the school holidays at the latest.
Fantastic.
And the orientation, the kindy orientation and all of those things, there will be information and guidance in there around all of those things. So we'll try and make those as comprehensive as we can around all the relevant questions that I know people have.
Excellent, thank you. We also had people wanting to know about specific activities. I'm sure you can guess which ones, particularly things like singing, instruments, cross-grade sport, those sorts of things which had been deemed high risk, and if there's any consideration of when they'll likely be able to resume, or if at all.
So I think that we have to learn how to live in a COVID safe way, and I think we have to recognise, and parents and staff and members of the school community need to recognise that things are associated with different risk level. It's a question of how do we mitigate those, and potentially the significance of those or the risk mitigations are less in an environment where we have low rates of community transmission. But we also need to recognise that that can change rapidly. So unfortunately, there is always a degree of uncertainty, but certainly with the low community transmission levels, we do recognise that those singing and some of those activities are associated with greater risk, the camps and other things, but there is a potential if we put in other mitigations and people are aware of those risks and do the normal risk assessments, that some of those guidance will be more permissive in term 4. But we also need to recognise that situation can change, and it is important that should the situation change, we may need to rapidly respond. And I think we've shown that we can work rapidly with education to communicate with parents, and that there is an acceptance that things always do change, and a willingness to work with us on those.
Thanks for that. Archana, we might go to you and see if you have any thoughts on this question. So someone has asked, now this has been a bit talked about in the media recently, given the evidence that's come out of the US talking about possibility of airborne transmission, the question is, what are some possible approaches to mitigating this risk in school settings?
Yeah, sure. So it's really in line with what Carrie and Marnie have said as well, in terms of, we know that there are certain activities that put you at an increased risk of transmission, such as, singing very loudly, blowing instruments, anything that, really propels kind of your voice so that it actually propels your respiratory droplets as well. And so those are things that we understand. And so as the community incidence increases, that we try to mitigate those specific activities. We also know that for some reason, and we think potentially, it could be a biological, maybe children who are of a younger age have different nasal mucosa, more of an immature nasal mucosa to older children, but children within the primary school setting and early childhood setting seem like they're less able to transmit the virus compared to older children. So it's also balancing activities versus, in terms of the incidence of disease in the community, but also in terms of potentially likelihood of transmission. So the younger you are, potentially you could do, you could engage in these activities, a bit more permissible than in the older age groups.
Thanks, Arch. You actually managed to answer 2 questions there, so that was very handy. And another one perhaps for you, what are your thoughts on PPE requirements for people doing one-on-one tuition?
Yeah, so that's really interesting. Again, it's all about the burden of disease within the community, but it's also about what you're doing. If you're teaching a student one-on-one and you're able to maintain that physical distance, then no, you probably don't need a mask. It also depends on the age of the child and the tolerability of the mask. If you wear a mask, you need to wear it correctly for it to be effective. So all those things really come into play.
Okay, just looking, we've had a bit of a rush on questions now. Okay, here's probably a good one, and in the back of everyone's mind is, now I probably Marnie might want to answer it, but Kerry might want to add in some of her thoughts. But particularly Marnie, what would be the plan for the HSC if a Year 12 cohort is affected by COVID at the time of the exam?
Well, you'll be pleased to know there's been a fair amount of work and thinking gone into this, hasn't there, Kerry? We've been working very closely for weeks now with NESA, the non-government school sector, as well as obviously internally. And there are some specific protocols that we have put in place. So there's a number of different strategies that we've got to address the risk of disruption to HSC exams. Probably the big one is the reduction in the number of students that we're actually going to be putting inside exam rooms. So we've capped that number so that if there was to be a confirmed case in a Year 12 student, we're minimising the number of close contacts and therefore the inability for those kids to be able to continue to sit the rest of their exams due to self-isolation. So, that has its operational challenges for schools, of course, but it's really all about making sure that we give kids the very best chance to sit as many exams as possible. We've also got schools looking at, and we're supporting schools in many cases, particularly our large schools, to look at alternative venues. So if somebody else at the school was to test positive and we needed to cease operation at the school for cleaning and contact tracing, we've got some additions to our confirmed case protocols where we obviously fast track the impact for the Year 12s and if necessary, we'll shift to an alternative venue where possible. Where some of our strategies can't be effective for some reason, we've got the illness and misadventure processes for students, so they won't be disadvantaged in not being able to sit those exams. So there's a whole raft of things which I won't bore everybody with, but there's a lot of detailed planning in place.
And I suppose just to add, that's probably why we've really wanted to get our HSC students through this really challenging year. They've really had a hard go of it. And that's why we've also suggested, you know, not mixing and some of those activities that would have increased interactions between parents and Year 12 students till after HSC is over, just to give them that reduced risk that inadvertently they come into contact and are designated as close contacts. We have had some cases where Year 12 classes have been taken out, and hopefully that might have added to the HSC experience of being in isolation and hopefully studying hard whilst in isolation. But obviously it presents other challenges if it happens in the part of the HSC, and we really want to make it as stress-free as possible for that very stressful HSC experience.
It's Christine. I think it's perhaps a shout out to the rest of the community too. You know, I think we are entering for schools this really important final term, and we've heard today how important it is that community transmission remains low. And obviously sometimes people can become fatigued with that, but I think if we can, you know, encourage the wider community to be taking extra care with all of the health measures that are advised, that'll help get the HSC students through too. We know that. So.
So we've reached the end. Thank you everyone for joining us today. A survey will be available in your browser window after the webinar. We very much look forward to your feedback. And there'll also be a link to the webinar video that will be provided via email in the coming days. But I will hand over to Professor Christine McCartney to say a few words.
Thank you, Helen, and thank you, Nick, also for being our host for the webinar at the beginning of this. I'd really just like to extend our thanks to all of you for joining in. I think it's been a great audience, some really good questions. Particularly like to thank, you know, Dr. Kerry Chant, our Chief Health Officer here in New South Wales, who's a very busy person, but for all of her support, you know, across all of this work, and for taking her valuable time to join us today. Marnie O'Brien from Department of Education, thank you so much. It's again been a pleasure for us as an organisation to be working with you, and we're really appreciative of the walk through the education response that you've taken us on today. And Archana from our team, and a shout out to the NCIRS team, I can't help but give, because I think they've worked incredibly hard. So again, we thank you for joining our webinar, and we look forward to seeing you again, and stay safe.